Dear viewers and followers at the different social media platforms, peace be upon you. I'm pleased to welcome you to this important e-symposium that is organized by Trend Research and Advisory as part of its different scientific event. We tackle a very interesting and important topic, which is the future of health security with COVID-19. You know that the COVID-19 pandemic affected the entire world, East and West, and this pandemic resulted into about 4 million deaths and about 200 million positive cases. So we ask several questions about how we can fight this pandemic because it is threatening the world. And of course, the health security is becoming increasingly a priority for the different government and international communities and institutions. And it's why there are different discussions about how to counter these threats and how to proactively fight the pandemics and epidemics and to curb their effect on our economic, social, and security lives. In this context, I would like to welcome to this discussion Dr. Badriya Al-Harmi, Public Health Consultant, Vice President of Emirates Public Health Association. You have the floor, Doctor. Peace be upon you. I'm pleased to take part in this important e-symposium. Today, we will talk about the future of health security in light of COVID-19 pandemic. In my presentation, I will go through several points. I will talk first about the concept of health security and the importance of health security and the different areas of this concept in addition to the relation between health and the security, the national security in particular, and how we can go forward in this concept. According to the WHO, the concept of health security tackles the different activity in a proactive, interactive way in order to minimize the threats and risks of health on our communities. So the health security is a term and is a framework in which there are engagements and commitments by different governments at the international arena. And of course, this has manifested clearly during the pandemic of COVID-19. For some people, they can say that this term is quite new, but it's not new. It started the circulation in 1994 in particular, and also some people call it the health sovereignty, and they mean that there can be different areas where the health can impact and interact with different domains. Why the health security is important to us? Of course, in the beginning of the 21st century, this notion has witnessed several developments, and especially with the spread of pandemics, epidemics, and of course the emergencies and the occupational accidents. With the start of this security, of this new security challenges, several stakeholders started talking about setting commitment to the stakeholders throughout the world because it's concerning to many governments and entities in the world because the pandemics and epidemics are very dangerous to our lives and they curb our social life, in addition to the economy and the development, tourism, education, transportation, etc. And we saw that very clearly and strongly during the pandemic of COVID-19. Now we will talk about the fields of the health security. There are four areas of the health security. There are the novel infections, and this covers the diseases that are new, or maybe they are not new, but when they spread and erupt, they cover a very large area. And of course, this causes a pressure on the healthcare system, and this affects tourism, travel, etc., in addition to causing awe. And we saw that with COVID-19, and before that with swine flu, with the SARS, etc. Second area is the chemical and radioactive incidents and risks. Of course, this is related mainly to the conflict zones when there are accidents in some nuclear reactors, etc. And this can cause a lot of disasters among humans and natural beings. The third area is violence, conflict, and emergencies, and with the floods, the earthquakes, the volcanoes, and the terrorist attacks and disasters, in addition to the different aspects of the climate change, there are several forms of the risks of the health security. Last field is food insecurity, and of course this is the most dangerous aspect because many countries suffer from the chronic diseases, leukemia, and food insecurity, lack of enough food. In the past, there has been some effort in order to improve that, but currently the interests are shifting, and the food security now is based on the quality of food per se. And we see now that many countries talk about sustainability. We talked about the health security, its importance, and its domains. And we know for sure that it impacts different aspects in our life. And there is a relation between the health security and the national security. And when we say national security, we do not talk only about the military economic might, but we talk also about political, cultural, economic, and health capabilities. During COVID-19, we have seen an expedition of what we can term the health sovereignty, which means that the healthcare system becomes one of the main strategic pillars of our security. And linking the health security to the national security is not something new, but it started in 1994 with anthrax and with SARS, and these attacks led some industrial countries to decide to include that in their national security. But this has manifested in a larger scope during COVID-19. And this concept is continuing its development. And after COVID-19 pandemic, there will be an increase in interest in the health sector in several countries because during COVID-19 we have witnessed that there is a lack of human resources in hospitals, clinics, and in the healthcare system in general. It's why there will be learned lessons to face such pandemics and also any biological risks. COVID-19 pandemic imposed on all governments in the world to give more priority to the healthcare sector. If we remember, in the beginning of 2020, the countries have not been ready to counter this pandemic. It's why we saw the collapse of the healthcare system in several countries, and of course, the economy of several countries collapsed also, which means that we have to give more priority to the capabilities in the hospitals and in the healthcare system. So, what we call the White Army is very important in pandemics, and also the different outlets should shed more light on the role of the nurses, doctors, etc., and all members of the White Army. And now they are more credited for the role they play in serving their communities and their societies. The aggravation of this pandemic and several attempts to find a vaccine, we have to say that we cannot face any epidemic or pandemic in the future only by following the distanciation and the physical distanciation, etc. We need to find a cure and remedy for this pandemic. We need to find vaccines that can prevent us from incurring these illnesses, or at least minimize the effect of the risks. Otherwise, the impact and effect of the pandemic is catastrophic, and we know that this will not continue for a long time, hopefully. The COVID-19 pandemic made the world realize that they should fight the pandemics together and to give to the healthcare sector more interest and make it a priority, especially that the pandemics can erupt quickly without any prior notice. And of course, we are more connected than ever in our world through the flights, through the travels, etc. So it's very easy for any kind of epidemic or pandemic to spread. And we cannot consequently fight these pandemics and epidemics separately. We have to fight them collectively, and even the responsibility is not assumed by one country or the origin of the pandemic or the epidemic, but it is a joint and collective responsibility. Even the international institutions, which are the World Health Organization, in addition to other stakeholders, they assume responsibility. Mohammed bin Rashid, the Vice President of the UAE and ruler of Dubai, has always made creative quotes. He said that if we ask ourselves what is leading what, is the politics leading economy or the economy leading the politics? And in COVID-19, we realized that we have to not focus on the economy, but we have to fight all the risks collectively, regardless of what we prioritize. And of course, the political will in our country realize that the national security is not restricted to the military aspect, but has larger forms. We have the health security, we have the political security, and the social security. It's why our country, thankfully, since its inception, started to give more priority to health, and it built a consolidated healthcare system, and that was proven during this pandemic, and we showed to the world that our example is comprehensive and multidimensional, and we thank God for this. Many people ask what will happen after COVID-19? What will happen to the health security, to the healthcare system? Will it remain as it is in its capabilities, resources, or will it develop more? The national security in politics and policies is one of the fields that will see increasing change, and we are talking about the concept of national security. Part of it, there is the health security. This crisis showed that we have vulnerabilities, several vulnerabilities. We are not talking only about developing countries or low-income countries, but industrial countries and developed countries. Several countries in the developed world found out that they have many weaknesses and many vulnerabilities and fragility. And after COVID-19, there will be a reconsideration for the health security of the individual and the whole nation. And at the top of that, there will be the health security. As we mentioned in the beginning, the national security was thought of mainly as covering the military aspect only, and it was not widened. But now, after this tough circumstances of COVID-19, the health security will be at the top of the agenda of all government in the world. We know now that it is a mere virus, but it turned our lives upside down. It's why it will be now part and parcel of the national security in all countries more than ever. We have to develop programs to face the challenges and to have a multidisciplinary approach in order to implement all the plans. And of course, we have to be proactive and preventive in fighting and countering the diseases. We have to forge partnerships, and we will invest in the prevention and controlling the diseases or minimizing the effects of the pandemic. We will invest a lot in this in collaboration with all countries. In the future, we will focus more on the following point: how we can manage to control the future epidemics. We will focus on the early alarm systems in order to control the dangerous threats to our national health security, and even those which are transnational, including the infectious diseases. We will consequently invest more in this early alarm system, how this virus started to cross the frontiers and the borders. We have to do something by allocating resources to make these early alarm systems more efficient and proactive. Second, the flexibility of the series of supplies, and these supply chains should be not depending on what place or the other, but it should be flexible and working in all circumstances. And we are talking here about supplies like devices, like medical materials, medicines. It's why we have to get flexible supply chains and a health infrastructure that is solid and that can allow the flux and the flow of different supplies without any interruption. Number three is the scientific infrastructure, and we can do that through the scientific research, medical development in the field of medical health and pharmaceutical industries. Because as I said in the beginning, we cannot follow only the social distancing and wear the masks and wash our hands. We have to support the scientists in order for them to develop the relevant cures, remedies, vaccines, etc. And as we said, investing in this field will help us protect ourselves and prevent ourselves from any aggravated results. Number four, the technological and the cyber security, which means that we have to protect our data, our medical, health, and scientific data. When we talk about the medical and health policies, we base our work on data in order to counter the infectious diseases and the pandemic that can erupt in the future. To conclude, I have to say that health has been very important part in the concept of the comprehensive national security, but it was not as important as it is now. The whole international community realized that we have to reinforce it more. Thank you very much for your listening. Thank you very much, Dr. Badria Al-Harmi, for your presentation and for your insight regarding the future of health security. Now we give the floor to our
Is Professor David Human, who is a professor of infectious diseases and epidemiology at London School of Hygiene and Tropical Medicine. He led the World Health Organization. Health Organization globally response to the SARS epidemic in 2003. Professor, we are more delighted to host you in this lecture. The floor is yours.
Thank you very much. Are you able to see my slides?
Yes, we are able to see.
Thank you. And thank you, Dr. Badea, for a very, very comprehensive discussion on health security. I will concentrate on only one of those 4 points you raised on infectious diseases, and in particular on the pandemic and how the pandemic has changed our view of health security, as you said earlier. I would just start by saying that health security is in many ways like a chameleon. A chameleon changes color depending on its environment, and health security also has changed depending on the environment throughout history. And before 2003, from Middle Ages, health security was collective protection against infectious diseases by actions at borders, trying to keep the disease out of countries. This began in the 14th century in Venice with quarantine. It then went into treaties in Europe and the Americas, a treaty that would permit countries to exchange information about emerging infections such as cholera or other diseases which caused outbreaks, so that countries around the world knew where these diseases were occurring. Then in 1920 up to 1969, there was an attempt to put global governance around infectious and emerging diseases by some international organizations, the League of Nations, and finally the World Health Organization in Geneva. And in 1969, the World Health Organization developed the International Health Regulations. These required countries to report to WHO if one of 4 diseases, smallpox, cholera, plague, or yellow fever, was occurring in their country. At the same time, airports and seaports were required to keep rodents and mosquitoes and other vectors of disease away by sanitary measures. And ships and international transport was required as well. And if a country reported one of those 4 diseases, then other countries could do something to prevent it from coming into their country as outlined in the regulations. This is a ship certificate required under the international health regulations that shows that this ship from Singapore was free of vectors or disease-carrying people. This shows what happened when a country reported to WHO. This, for example, is yellow fever reported to WHO. When WHO received the report from a country, it put it in its weekly bulletin, and then other countries looking in the regulations could see that they could require a yellow fever vaccination if people arrived in their country from that site. So these were trying to stop disease at borders. So before 2003, the world was trying to stop infectious diseases at borders. We know, though, after 2003, and many knew even before, that borders do not offer protection against infectious diseases. You cannot stop an infection at borders. And this became very clear when a doctor from China came into a hotel in Hong Kong with an unknown disease. This is the floor in the hotel where he stood. He was very sick, and he stayed in room K, which is green. People staying in rooms that are blue became infected from this person, probably because he vomited on the floor in front of his room or in front of the lifts. These people then went back to their own countries, taking the infection with them and causing the SARS outbreak in 2003. That outbreak was controlled by measures done by countries and by WHO, because as Dr. Badaya said earlier, it's very important that countries work together. And during the SARS outbreak, they did work together. And they decreased travel to countries where outbreaks were occurring, and they stopped the outbreak. But there are many, many more infectious diseases, emerging diseases, than just SARS. And here we had the international health regulations, which only included 4 diseases: cholera, plague, yellow fever, and smallpox. And so in 2005, after the SARS outbreak, the regulations were revised. And what's most important is that they changed it from trying to stop disease at borders to putting the responsibility on countries to detect and respond to diseases so that they don't spread internationally. And if they were unable to do that, then there was a system in place, a safety net, that would respond. So the core function of the international health regulations today is not disease reporting. It's a requirement of every country to strengthen their core capacity for surveillance and control. In addition, there's a safety net that's provided so that if countries can't stop the disease and it becomes a public health emergency, there's a global response required under these regulations. So this is what countries are required to do as far as their public health capacity. They're required to fill out a standard compliance certificate each year and provide it to WHO, and they're required to continue to strengthen their capacities until they have all green flow in their capacities. At the same time, if a country has what might become a public health emergency, they're required to report that to WHO. And then the Director General can decide whether he wants an emergency committee to meet and wants to call for a global response. So this is the safety net if countries don't have the capacity to stop a disease. This is how countries determine whether or not to report a public health event to WHO. It's a decision tree. And I'll show you how that works in the Zika outbreak, which occurred. The question was, is this a public health emergency of international concern? The Brazilian government went through this decision tree, and they found that this was a very important public health issue because it was having an impact and the event was serious. People were becoming microcephalic. So they said yes. Then the next question was, is the event unusual or unexpected? And they said yes. We don't expect to have clusters of microcephaly. Therefore, the event was to be reported to WHO. They reported it. WHO convened an emergency committee, and that emergency committee recommended to the Director General that he call a public health emergency, and the world worked together afterwards to better understand and deal with this infection. So after 2003, it was clear borders do not offer protection. The international health regulations were revised. But after 2014, after the Ebola outbreaks in West Africa, we also understood that healthcare systems are required for health security, as Dr. Badea said earlier. And so we saw this in the outbreak of Ebola in 2014 and 2015. In that outbreak, in industrialized countries, they were still trying to keep it out through border measures, but in developing countries, their hospital system collapsed. They could no longer take care of all the patients that they were not required to take care of because of weak hospitals, but also because health workers became infected and died. And if you look at what happened when international health workers became sick during the SARS outbreak and were sent back to their own countries for care, the majority of them survived. Whereas in this situation, very few people were able to survive, were able even to get health care until Doctors Without Borders and other groups came in. In addition, because those health systems collapsed, there were also increases in malaria, in other diseases such as measles, due to the fact that people couldn't get routine health care. And so after 2014, health security also had another element involved. Robust health systems are required for health security. And finally, we come to the pandemic, and this is the picture of the pandemic as of the 21st of June. And you can see in this, the Eastern Mediterranean region in green, you've had a fairly constant level, slowly increasing level of disease, which is now becoming endemic throughout the world. Now, hospital systems collapsed even in industrialized countries during this outbreak. So that proves that robust health systems must be developed in all countries as a part of health security. This shows you what happened in Italy. They had to put up tents in order to take care of their people who had COVID infection. There were also an increased number of deaths which were caused by COVID, but also deaths which were caused by people not being able to access the health system in all countries, including industrialized countries such as the UK, and in this instance, you can see in the United States. But in addition, there's one further element that no one really considered as a health security element, and that is healthy populations. Because the people who are getting very seriously ill and dying when they get infected with the SARS coronavirus 2 are those people who are obese or who have underlying health conditions. They're the ones who are major burdens on the health system, and they're the ones who become very sick and die. So we know today that health security requires collective protection through strong public health, and we've seen that occurring, but we've seen that countries aren't so willing to work together as they were during the SARS outbreak in 2003 or during Zika, and that needs to be rectified in the future, and we've seen 4 ways that can be done presented by Dr. Badea. In addition, there needs to be access to robust health facilities so that all people can get care, and there need to be healthy populations enabled by effective health promotion so that people have healthy lifestyles and, in fact, are not susceptible to infections. So today we see that health security is much different than what it was thought to be before 2003, when countries were trying to stop infectious diseases at borders. So thank you very much. That's what I've had to say this morning, and I'm very pleased to participate with you. Thank you very much.
Thank you very much, Professor. And we have some questions from our audience. I will go with the first question. How important are international transparency and coordination to effective global health governance?
Thank you. Well, I think that Dr. Badea clearly outlined what's necessary. It's necessary that people work together. That worked very well during the SARS outbreak. It's worked very well during MERS outbreaks when they've occurred in countries around the world. It's worked with Zika, but it hasn't worked in the current pandemic, as Dr. Badea said. So there will be many different attempts now to see what went wrong and how that can be rectified in the future. There's been an external evaluation of the international health regulations at WHO. There's been a commission that was set up to look at WHO's activities. They've made some recommendations, but we need to be sure that our politicians, who sometimes have short memories, remember that they need to have a long memory this time and follow those steps that were laid out by Dr. Badea so that we can have a comprehensive collective health security.
Thank you very much, Professor. I have another question. How could states deal with their own health security? What are these policies that could be input for this purpose?
You know, the most important is that countries develop capacity in public health. Good surveillance systems to detect infections, good response mechanisms to stop those diseases from spreading within the country and from spreading outside to other countries. That's our primary defense. That's why the international health regulations were changed to put the emphasis on countries. We as countries are all responsible for disease within our borders. And what we can do best is work together to prepare countries. I know there's a lot of cooperation going on between the Middle Eastern countries and African and Asian countries, and that needs to continue to strengthen the capacity in countries to detect and respond to diseases so that they don't spread internationally.
Professor, let me ask you one more question. Thank you. First, you took us through the whole changes of the regulations of countries and the WHO. But I want to ask about the new viruses can develop like COVID. COVID is not new. There was like a new strains and new epidemics. So how we like doctors or professors like you, how are they put scenarios for new viruses or new epidemics can spread on the world?
You know, what I think we need to be doing better is working with human medicine, animal medicine, and the environment closer together, because all of these things are important in the emergence of a disease such as the current SARS coronavirus 2. So if we can work together in all those three sectors, we can begin to stop having to use humans as an indication of infection, but get back to animals and maybe even back to the source of infection. So what we need to do is we need to learn from each other. And there are some programs that are developing in One Health, which is what this is called, where there are master's students. For example, here in London, there's a course between the Royal Veterinary College and, in addition, the London School of Hygiene and Tropical Medicine. And those groups are working together to offer a master's degree in One Health, which will permit people to better understand each other moving forward and hopefully prevent pandemics such as the current pandemic.
And thank you again. Thank you very much, Doctor. We are more honored to host you on Trent. Now I will switch to Dr. Badria.
Badria. Dr. Badria, I have several questions. If you can answer them first, how COVID-19 will impact the government expenditure and the development of health policies, in your opinion? As we mentioned, the health security is very important to the national security, and the health security is not less important than the military security. It's why we have to allocate all the resources in order to protect the inhabitants of the world from different risks and dangers that can cost them their lives, and also other aspects of their life. So I expect that this crisis will change a lot, or radically a lot, of our practices regarding the priorities of expenditure and spending. I think that this will also change. There will be a focus on building hospitals and health care institutions, because as we saw in the beginning of the pandemic, we saw the collapse of a lot of infrastructure in the health system because of that. And also there will be a boost to scientific research and development, and medical research in particular. And we know that we have to focus on that, because simply that giving importance to that will allow us to find cures and remedies and vaccines for prevention in order to minimize the risks. In addition, of course, in my opinion, there will be an investment more in the public health, as Dr. David said, and there will be more investment in the capabilities, human capabilities in the healthcare. This specialization is not less important than any other specialization, but the opposite is right. The prevention is of utmost importance now, and minimizing the risks of epidemics and pandemics is becoming more and more important. So I think that the countries will be more interested in that, and it will set the priority of the health security at the top of its agenda. Dr. Badria and Dr. David, I have a joint question. Do you expect that, because you know that there was a crisis and everyone prioritized health and public health? Now I'm talking about the whole world. The public health, as Dr. David said, some politicians, he said, they have a short memory because they change their priorities and they focus again on economy, on military, on cyber space, etc. So they shift quickly. And given the fact that COVID-19 has affected badly the world, and in some cases, there were asymptomatic cases. Do you think that we will really manage to shift our focus and have a longer memory? Because the politicians, they forget easily, and again they focus on economy and politics. Do you think that the countries will continue prioritizing health in the future? Professor David, if you'd like to answer first. تفضلي دكتورة بدرية. حسنا، أتوقع وكما قال الدكتور ديفيد I think that the memory of some politicians will not be short, and we can notice that among the learned lessons this time in the public health, we have a role to tell the decision makers that this is a very important field, how to counter the pandemics and epidemics. And when the decision makers hear what we say and hear the specialists, when they ask us about what are the priorities, what are your concerns, of course, they will shift their focus. And when we are concerned about some diseases, I'm sure that in this case, decision makers will be enlightened. So we have to explain to them and to keep in touch with them in order to convey to them that there should be more enlightenment. I think that it is the responsibility of the specialists in the public health to convey this important message to the decision makers and to do that continuously, not periodically. I think that by doing so, the decision makers will manage to keep the public health as a priority in their agendas. So I think it is a joint responsibility. And of course, this is not a unilateral effort. It should be a multilateral effort by all the specialists, all the stakeholders, the decision makers. And of course, this is us humans. We tend to have a short memory, but we have to remind each other from time to time. The priorities will be different. And of course, this is the future, and we will see different epidemics and pandemics, that for sure. It's why we have to get a proactive approach and to assume a joint responsibility to tell the decision makers what are the things that they should focus on, because we consider ourselves specialists.
I fully agree with what you said. And, you know, if there's been one issue that's been very difficult during this pandemic, it's the public health people to have a voice, because many times they say one thing, but their governments say something else. That's happened in the UK, it's happened in the US, it's happened in many, many countries. The countries that have dealt with this best have been those that have listened to their public health leaders, such as Germany, for example, which listened early on. And I know many countries in the Middle East also listened to their public health institutes rather than governments just trying to make a decision. So what we need to do is figure out how the public health community can really continue dialogue with heads of state and push that forward. There are, however, some new things that have come from this pandemic, such as the ability to make vaccines very rapidly, which hopefully will continue in the future. But what we need to do is make sure that there's enough capacity to produce these vaccines in both developed and lower middle income countries. And that's a role that many countries, including countries in the Middle East, could be playing even now in developing capacity to produce vaccines for the rest of the world. India has done that. They've developed that capacity, but they're now saturated with their own needs. Other countries have done that. Malaysia, for example, produces vaccines. But Middle Eastern countries have resources to do that as well. And that could be a priority for many countries in the Middle East to set up production capacity to produce vaccines during times such as this.
الإمارات تقوم بذلك أيضا.
The United Arab Emirates is doing that also. It produces a vaccine and it submitted a number of vaccines to India and other parts of the world. The role of WHO, Dr. David, do you think that COVID-19 impacted positively, or maybe there is working in silos by states and countries and the lack of working together? Do you think that will change?
There are a group at WHO, the World Health Organization, which is called the Scientific and Technical Advisory Group on Infectious Hazards. And we're providing guidance to WHO when they ask on issues around COVID, around Ebola, around other infections. So we work with them regularly. But WHO has not been able, for some reason, to get people to work together outside of within the world. People just are not working together. Hopefully, the Act A facility, the COVAX facility, which contains WHO and other groups, will be able to get the world working more closely together to get diagnostic tests out to countries and to get vaccines out to countries and other therapeutics out to countries as they need them. So maybe we have a new facility, the ACT Accelerator, which has the COVAX facility and other groups. It may be that those will remain after the pandemic and be a way that WHO can work with others, not just alone, to try to make sure that there's more equitable distribution of goods during and possibly even before pandemics so that countries can be better prepared.
Thank you very much. شكرا جزيلا.
To conclude, I would like to say on behalf of the director, the CEO of Trend Research and Advisory, I would like on his behalf to thank Dr. David and Dr. Badria for their insights in this event. We wish to see you in future events. Peace be upon you.